Hello friends, welcome back to Complete Medical Coding. Today let's discuss few more anatomy questions. Okay, few more important medical terminologies as well as some anatomy questions from the CPC examination which was conducted in the years 2024 as well as 2025. Some common questions and some important questions. All right, so hope you people are finding my videos useful. So please share it among your friends, especially for those who are preparing for the examination. So thank you so much for all your support. Please subscribe if you are new to the channel. So let's move to the questions. Moving to the first question. First question. The valve between right atrium and right ventricle is. So which is the valve that is between or that connects right atrium and the right ventricle? The name of that valve, heart valve. Option A, pulmonary. Option B, aortic. Option C, bicuspid. And option D, tricuspid. So which valve connects the right atrium with the right ventricle? The answer is option D, tricuspid. Okay, the tricuspid valve connects from the heart, or it transfer blood from the right atrium into the right ventricle. All right. Second question. Study of tissue is called. What do you call for a study of tissue? Option A, osteology. Option B, cytology. Option C, histology. And option D, dermatology. Study of tissue is called histology. Okay, the answer is option C, histology. So what do you call for the other one, like osteology, cytology, the other options? Let's see that also. Osteology is called as study of bones. Cytology is called as study of cells. And dermatology is called as the study of skin. Okay, few might be knowing. Anyway, these are simple questions. You can expect simple questions as well. Okay. Anyway, moving to third question. Which sweat gland is present in the axilla? Axilla, which sweat gland is present? Option A, apocrine. Option B, sebaceous gland. Option C, eccrine. And option D, ceruminous gland. So which sweat gland is present in the axilla? Answer is option A, apocrine. Apocrine gland is the gland which is present in the axilla. Okay. Moving to fourth question. Which of the following conditions is characterized by the presence of kidney stones? Kidney stones are also called as renal calculus. Okay, you might get different terms for the exam. So kidney stones are otherwise called as renal calculus. So which of the following among the options is characterized by the presence of kidney stones? Option A, glomerulonephritis. Option B, interstitial nephritis. Option C, nephrolithiasis. And option D, polycystic kidney. So which of these medical terminology refers to presence of kidney stones or refers to as renal calculus? Everything, almost everything, it is connected to the kidney with the term. It is connected to the kidney, but kidney stone, which medical terminology represents or mark it as kidney stone? Answer is option C, nephrolithiasis. Okay, nephrolithiasis is considered as kidney stones or renal calculus. Alright. Fifth question. Specimens for gonococcal cultures are most commonly obtained from which of the following structures in men? So in men, specimens for the culture, gonococcal culture, is obtained from where? Which part of the body? Option A, anus. Option B, bladder. Option C, skin. And option D, urethra. So the culture, gonococcal culture specimens are collected from which part? It is from the urethra. Answer is option D, urethra. Okay. Sixth question. Even though this is a simple question, anyway, let's read it out. What best describes arthralgia? See, that's what. This is a simple question, but if you see the options, everything looks same. Option A, pain in the bone. Option B, pain in the joint. Option C, pain in the axial skeletal. And option D, pain in the lower back. So what best describes arthralgia? What exactly arthralgia means? So like that, you will get, similar meaning, similar option. In the options, you will get similar terms or similar, which looks same as the answer. But there will be a single specific answer or medical term for that. So that you have to identify. Okay. So what best describes arthralgia? What do you exactly mean by arthralgia? It is something pain only, whether it is pain in the bone or pain in the joint or pain in the lower back or pain in the axial skeletal. What it is? It is pain in the joint. So answer is option B. Arthralgia means pain in the joint. It could be wherever, whichever part the joint is, that is the pain in that joint, is particular joint pain, you can say. Okay, that is called as arthralgia. You will get n number of questions or n number of medical coding related queries or claims related to arthralgia when you start your career. Okay. Moving to 7th question. If the patient is diagnosed with dacryocystitis, it means the patient is having inflammation of which area? So basically it means, the question is, what do you mean by dacryocystitis? Dacryocystitis, itis means inflammation. So what does this dacryocystitis means? Inflammation of which area? Option A, lacrimal sac. Option B, eardrum. Option C, cornea. And option D, fingernail. So dacryocystitis means inflammation of the lacrimal sac. This is a very important question and it's commonly asked in the CPC questions. Okay. So dacryocystitis means, answer is option A, inflammation of the lacrimal sac. Alright. Now 8th question. Which of the following is a part of peripheral nervous system? So as you know, there are two parts. Nervous system is divided into two parts: central nervous system and peripheral nervous system. So among the options given, which is a part of the peripheral nervous system? That you have to find out. Option A, dura mater. Option B, spinal cord. Option C, pons. And option D, brachial plexus. So which is a part of the peripheral nervous system? Answer is option D, brachial plexus. Brachial plexus is the part of the peripheral nervous system. The remaining are part of central nervous system. Okay. Moving to the 9th question. Which of the following structures is a part of the small intestine? It looks simple, but it's important as well. Those who are from science background, you will be knowing, but as you know, nowadays many coders are coming out, especially those who are not from the science background. So those people, don't worry, you will definitely get a job. You can definitely win. You can definitely pass the exam, but just this type of anatomical medical terms you have to, you should be knowing. That's very important. Okay. So which of the following structures is a part of the small intestine? Option A, ascending colon. Option B, cecum. Option C, ileum. And option D, sigmoid colon. So which is a part of the small intestine? Answer is option C, ileum. Ileum is a part of small intestine. Okay. The remaining ascending colon, descending colon, cecum, everything is a part of the large intestine. Alright. Moving to 10th question. Which of the following organs removes bilirubin from the blood, manufactures plasma proteins, and is involved with the production of prothrombin and fibrinogen? Okay. So, as you know, bilirubin, if you hear the term bilirubin, you should be knowing which part it is, which internal organ it is related with. Still, go to options. Option A, gallbladder. Definitely no. Option B, spleen. Option C, kidney. And option D, liver. So, which is the organ which is connected to bilirubin? Of course, the answer is option D, liver. So, liver is the organ which removes bilirubin from the blood. And what are the other functions of liver? Manufactures plasma proteins and is involved with the production of prothrombin and fibrinogen. You could get different type of questions from this question. Okay, like which part of the body is involved in the production of prothrombin, or which part of the body is involved in the production of fibrinogen. Like that also you might get questions. So liver is the answer here. Okay, so that's it, friends. So as I had mentioned you earlier, nowadays many medical coders are, it's a huge quantity. I mean, huge number of people are passing out the CPC examination. So many medical coders are coming out. And then if you can check the number of medical coders who are passing, it's almost equal to those who are from the science background and those who are not from the science background. So those who are from the science background, you can easily pass anatomy questions. Okay, but those who are not, of course, it will take time for them to understand. It will take time for them to learn more and more terminologies. So that's, even though if you go for a CPC examination course, they will teach you the whole CPT code book, the guidelines, everything, the whole ICD code book, the whole HICPICS book, everything they will be teaching except the anatomy. Of course, that you have to learn by yourself. So that's the reason I'm coming up with n number of anatomy questions, anatomy and medical terminologies. So you can easily score marks from these portions. You don't have to skip out anything from this. And if you know the anatomy questions, of course, you can easily save time. 6 questions you can immediately, in less than a minute, you can answer those questions. Like that, you can save time for, you can use that time for other questions, because there are case study questions coming up. So that also you need time. So that's it. Anyway, thank you so much, friends. Those who are new to the channel, please don't forget to subscribe. Please press the bell button so you will be getting notifications whenever my video is getting uploaded. And if you find this video useful, please share it among your friends. Any doubts, any clarifications, any queries, please mark it in the comments and I'll be getting back to you soon. So thank you so much, and see you in the next episode. I'll be coming with more and more practice questions, along with more questions also. Chapter wise practice questions, of course, I'll be coming, and more questions also. Let's do in between. Okay, so thank you so much, and see you in the next episode. Thank you. Take care. Bye. Stay tuned, friends. Bye.